Good evening. Welcome to our first virtual annual general meeting of the NHS Somerset Clinical Commissioning Group. My name is Lou Evans and I am the Vice Chair of the governing body and I will be chairing tonight's meeting. We have apologies from Ed Ford, Trudy Mann and Basil Fozzard. Arrangements are a bit different this year, but we are still keen to involve as many people as possible in the work that has taken place across the last year. Today's etiquette will be as follows. We will be presenting the annual report for 2019-20 and also providing an update on the CCG's response to the COVID pandemic. You can ask questions and provide comments through the Q&A function box on your screen. You can either post your question or comment anonymously and by using your first name. We ask you not to provide any personal details or personal identifiable information in your questions and comments to safeguard your confidentiality. Ask questions and provide comments through that Q&A function. Our moderator will collate all the questions and comments and share these to myself at the end of the presentation. Time permitting, we will then answer those questions when we can. If not, we will get back to you individually. We will publish all the questions and answers on our website in the next few days, somersetccg.nhs.uk. And just a quick reminder though, there's an opportunity, as I've said, to ask those questions, but please don't make them personal. So we're now going to get into the formal part, and that is really to approve last year's minutes. Now, normally we would have a show of hands, a proposer and a seconder, but of course we're not going to do that. We have, however, circulated to the attendees, so hopefully everyone has those. They were brought to the governing body in January for endorsement, and they're here this evening for formal approval. We don't have a virtual hand on this platform, so unless there's anybody from the GB members with a specific objection, we will take these minutes as approved and a true and correct record of the previous annual general meeting. I would now like to hand over to James Rimmer, our Chief Executive Officer, for a reflection of 2019-20. Over to you, James.
Lou, thank you very much. What a year it's been. So formally, I'm going to present the annual report for 2019-20, which takes us from April 2019 through to March 2020. But clearly the pandemic touched us, particularly towards the back end of that year, January, February, and particularly March. So we will touch on that. And as you've highlighted, the second half in particular, we'll have a chance to go into that in some detail. What I would like to do, though, is just to pass my huge thanks to the people of Somerset and the way we've responded to the pandemic, to health and care colleagues across Somerset. We set out with a dual ambition to address the pandemic of keeping the people of Somerset as safe as we can and keeping health and care colleagues in Somerset as safe as we can. Those remain our aims. In terms of our own focus, it's been on working together to improve health and care in Somerset, and there have been huge demands on us in that. But nevertheless, we are focused on that, and it's the working together that drives us forward. So our vision in Somerset remains working together. We want the people of Somerset to be able to live healthy, independent lives within thriving communities. And our strategy is guided by what we call Fit for My Future. And again, we will touch on that later. But I always love the diagram we have of that, which shows the household at the heart of services. And then we escalate into neighbourhood and community support, primary care and secondary care as they're required. So all partners across health and care working together to get services in the right place, in the right time. For the people of Somerset, and we do all this with huge thanks to our neighbourhood teams, the voluntary sector, to our health and care colleagues, and indeed tonight and with the presentation of this annual report, to members of colleagues in the clinical commissioning group and our governing body as part of that. What drives us, though, are our values. If we can stick, are our values, and our values were defined by our staff colleagues, and really pushing forward the aims of always trying to get things better through quality improvement, the integrated working, and we do that with personal integrity, compassion, and self-awareness, so that the whole time we're thinking, how is it for me, for my family, in terms of making sure that we're caring for the people of Somerset as if we're doing it for ourselves and our loved ones. So what is it specifically that the Clinical Commissioning Group or the CCG do? Let's go on to the next slide. So we're a key part of the NHS family in Somerset, and we've got the responsibility to do that strategic planning based on the health and care needs and working closely with public health colleagues for the needs of our population. So we do that planning, the commissioning or buying of services, and then the assurance or monitoring of those services. And that's the process called commissioning. And we're very fortunate in Somerset to have a large number of high quality providers that we're able to commission services from. So we'll move on to those, onto our providers. First and foremost are our primary care colleagues. So as a clinical commissioning group, we're driven by the needs of primary care as a membership organisation, and we've got 65 practice members who see over 3 million patients a year through consultation. So it's a tremendous response from primary care in Somerset. Our Foundation Trust colleagues, there's 2 based in Somerset physically, Yeovil District Hospital and Somerset Foundation Trust, but about 20 to 30% of the population is served by the Royal United Hospital in Bath and by Western Hospital, Western General Hospital, now part of University Hospitals Bristol and Western. And indeed, when I describe those 4 Foundation Trusts, I would recognise that over the year, Somerset Foundation Trust has come together right at the end of the year, which was a merger of Taunton and Somerset Trust, based around Musgrave, and Somerset Partnership based around community and mental health, and likewise University Hospitals Bristol and Western, bringing together the Bristol hospitals and Western General Hospital. We're also fortunate that we have the out of hours service provided by our ambulance colleagues, South West Ambulance Service, and our out of hours primary care colleagues and Devon Doctors, with the 111 service as well, and independent service providers. But I've touched on it before, but the huge number of colleagues that wider health and care range from social care, our hospices, the community mental health teams, the charities, the voluntary sector, and a plethora of people supporting neighbourhood services here in Somerset. So thank you to all our colleagues. And who are they all here for? They're here for the people of Somerset. And I always enjoy this infographic because it talks about if Somerset was a village. And we know across Somerset about half of the people of Somerset live in urban communities and about half in rural. So that village life is so pertinent for many. We have on the young side about 20 out of 100 are under 18, so children and the children's services we provide, and about 24 are over 65 or over. So as part of that, and increasingly we're expecting the 11 of those would be 75 or over, and indeed we're expecting that level to double over the coming years. So we are getting older. In fact, our life expectancy is good, with 80 for men and 84 for women in Somerset. However, we do know that there are some challenges for us. 9 people in this village who would be living in deprived communities, and whilst it's 80 or 84 for the average, we know that life expectancy for men is 6 years less in a deprived community and 5 years less for women. So we've got work to do to reduce that inequality, a huge driving passion of ours as well. And there are a number of factors here, but perhaps I'll pull out the ones where we can most impact on lifestyle. Alcohol, smoking, and healthy living around that, and the challenges that brings us. So each year, unfortunately, we have 1,700 hospital-related admissions due to alcohol, and so the opportunity to improve that through our prevention programs. This graphic talks about 16% of adult smoking. We're delighted it is reducing, it's steadily reducing. The latest data we have actually that I've just been updated with is 14.4%, so it continues to drop. But every stop smoking makes a difference in terms of health. And finally, that healthy living, the opportunity of active living, 2 in 3 are overweight or obese. So real lifestyle factors about where we've got the opportunity to make it. So when we think about improving health and well-being, there are factors we can work on, and we're committed to doing those. So that's the people of Somerset. What about the people of the Clinical Commissioning Group and our staff colleagues? They are wonderful, our staff colleagues. They are committed to improving services for the people of Somerset. They're here to serve, and over the last 6 months, we've witnessed incredible, over the last 18 months, through the period of the report, but also in the last 6 months, incredible flexibility to get things right for the people of Somerset. Huge thank you to staff colleagues. We've had a huge programme of work in place about becoming a better place to work. So we as employers recognise that we want it to be a better programme. And so we've got our high performing organisation programme that we're committed to in developing our staff, and we've put in place an organisational development programme for that. I've talked about the opportunities for health and wellbeing. That applies every bit as much to staff colleagues, and so we've really been promoting that with amongst colleagues, everything from flu jabs through trying to encourage people to live healthier lifestyles and the balances. And then staff supporting staff is incredibly important with our compassionate network, the opportunity to talk to a member of staff, our staff forum, making sure that at all levels staff voices are being heard, and the agile ways of working that we've really seen come to force over the last 18 months, but particularly as people have had to be flexible in their ways of working over the last 6 months. So a huge thank you to colleagues. We're committed to develop you in the way I know you're committed to your roles and to developing services for the people of Somerset. And together we've made a big difference. So we'll look at our successes to start with. Huge successes, and I'd start off with primary care, right at the heart of it. So over the period of the annual report, in April 2019, we took on primary delegated commissioning responsibility for primary medical services. And that's gone incredibly well. So the managing, processing and commissioning of primary care in Somerset across those 65 practices. And, I'm delighted that our practices have responded well. One of the kind of quality measures is the quality and outcomes framework. In Somerset, the qualities and outcome framework response is 96% higher than the national average of 95%. And that's a great indictment to primary care colleagues, and so that partnership is working well. We've also been developing over that period the primary care networks, and we have 13 primary care networks to match across the neighbourhoods, 12 neighbourhoods with social care colleagues. We've got 2 in one of those neighbourhood areas as a way of working, and they're committed to that neighbourhood way of working and really being able to kind of go to that local area to make a difference. Recruited new staff, really thinking about the pharmacy support we're able to put into those areas, medication reviews, cancer, and enhanced care in care homes, really pertinent at this time and as we move forward. So thank you to those colleagues. We're going to come on to transforming mental health services later in the presentation. If I can go back, stay with that previous one, Julie. We've made a big difference around online access to tools, and again, very pertinent, very timely. Significant change in antibiotic prescribing, which makes a big difference in terms of how both we as a county and across the country are able to react to infections when they do come. And again, kind of very pertinent in the current times. Our pharmacy colleagues have been working, our community pharmacy colleagues working incredibly well with us, supporting domestic abuse, and making sure we can support the victims of domestic abuse with consulting rooms in that. So big difference. And finally, I just wanted to pick up the huge reduction in continuing healthcare waiting times that we've really been able to do working together with colleagues from social care. So big thank you to our colleagues in the continuing healthcare team, but also our social care colleagues. It would be remiss of me not to address the challenges as well. And we've had financial challenges, and I'll pass over in a minute to our finance director, but we are moving towards constantly up through the ratings, and we're wanting to get now our rating of good. We've been able to improve our mental health services and mental well-being, and that affects at any given time about 1% of our population are living with serious mental health illness. And indeed, we're a trailblazer for some of our community-focused mental health services, and we've been able to get extra investment in Somerset to the tune of £13 million for those community mental health services and £4 million for children and young people. So significant investment in mental health services over this period and moving forward. The caring for older people. So whilst I talk about 1884 being the life expectancy, we also know that it can be 10 to 15 years of the last period of that life of our lives being in ill health. So we're committed to really making sure that we support people and improve healthy life expectancy as well as life expectancy as part of that. And then finally, I touched on the importance of making sure that as we develop our services going forward, we do so in a way that meets the public purse and is sustainable moving forward. So those challenges remain with us. So that moves us then to our priorities looking forward. So kind of as I look back on the previous year, I need to look forward to where we're heading. And the 7 priorities, 3 of these around partnership working, incredibly important, 3 around our services, and underneath them all is our response to COVID. So the partnership working, firstly with members of with the public and our public involvement and engagement, incredibly important. We're here to serve you the people of Somerset, and please do keep us true to that, and we'll be true to it as well in terms of our engagement. Secondly, our health and care colleagues across Somerset, and we're moving towards wanting to become an integrated care system. That's nothing, it's a new way of working, but it's actually building what we're already doing, that partnership working. So together we're better, and I think we model our services around the way people live their lives, and so we should have our services to meet the way you live your lives. And thirdly, the community and neighbourhood teams, the voluntary and third sector, who do so much to work for the good of the people in Somerset, improving health and well-being, without on whom we are so reliant and play such a key role. So those are the 3 key partnerships I wanted to flag up. 3 services, and I think all our services are important, but firstly we need to be ready for winter, always a challenge for us, and we work with colleagues right across the system for that. It always brings a wry smile in April and May when we start our winter planning, the sun shining brightly, but nevertheless we need to make sure we're doing that at all times. Secondly, to make sure we've got infection protection and control support, crucial at this time, and we've done a lot of work over the past year, particularly working with care homes on that, and thank you to colleagues for that. And finally, our SEND. So we had our SEND inspection in March in the period of the annual report. It got published in May. Clearly, it's highlighted the huge amount of work we need to do on that. We're making improvements, and we continue to. We've got a special educational needs and disabilities group that's now looking at that, taking those improvements forward, and we're committed to that. So I just wanted to flag that here, the importance. And then finally, I did say we'll touch on this, and we will go on to it in the second half in particular, but looking forward, our ongoing response and recovery for COVID is important, and it is both of those things. COVID is very much with us, and we'll be hearing later from Trudy Garrett, our Director for Public Health, about how we respond to that. But we also know we need to continue ongoing health services as part of, and we're picking up a lot of work to make sure that we do both the COVID response and we're supporting people in their health services. So that ends my section, the presentation of the annual report to you. I hope you'll find the time to read it, and I hope you'll find it as rewarding as I do in terms of having had the ability to kind of pull it together on behalf of the team. A huge thank you to colleagues, both for writing it, but also it underlies a huge amount of work. So many thanks to colleagues for that. I'll now hand over to my Director of Finance, Alison Henley, who will take us through the financial picture, which sits alongside the activity we've been undertaking. Alison.
Thank you, James. So part of the AGM is to present the annual accounts, and I have the pleasure of doing that this evening. We have made significant progress in improving the financial position in Somerset and making sure that health services are safe and available when people need them. We aim to be a responsible commissioner who makes the best use of the money and resources available to us for the people of Somerset. So if we move on to the next slide, the Somerset system spent 893 million in 2019-20, and this slide demonstrates how we spent that for every pound. So picking up some of the key highlights that are shown in this slide, we spend approximately 50% for every pound on secondary care commissioning, and this relates to the services carried out in our large acute hospitals. The majority of this, as James has said, is spent in Taunton and Somerset NHS Foundation Trust and Yeovil District Hospital Foundation Trust. But we also buy services from other providers, which include Royal United Hospital Bath, University Hospitals Bristol and Western, and Royal Devon and Exeter NHS Foundation Trusts. Drawing out some of the other areas, we spend approximately 20% of our spend on primary care services, and this includes services provided by all our GP surgeries and the cost of any medications prescribed. And finally, just in terms of drawing out on this slide, the third area is around community health services, where the majority of the spend relates to services supplied by Somerset Partnership NHS Foundation Trust, but also includes services bought jointly with Somerset County Council, non-emergency patient transport services, and hospice and end-of-life care services. So moving on, the CCG has a number of financial targets. The CCG was allocated 44,000 to spend on items of equipment which are in excess of £5,000, and this is called capital expenditure. In 2019-20, we spent the funding that was made available to us. In addition, the CCG is given funding for day-to-day operations, and this is called revenue funding. In 1920, the CCG was allocated 877 million, but unfortunately, the CCG ended the financial year by spending approximately 16 million more than was available to us, and as such, this slide demonstrates that we failed those financial duties. So where does our money go, which is demonstrated on the next slide? The slide shows that in 1920 we spent 893 million, and picking up some of these further areas a little bit more, the CCG spent approximately 70 million on mental health services in 1920. Most of this spend was within Somerset Foundation Trust, Somerset Partnership Foundation Trust, with an additional spend supporting aftercare services, children and young people through the voluntary sector, and dementia services provided by the Alzheimer's Society. 51 million supports continuing health and funded nursing care, and this supports people who need additional support in nursing homes or in their own home. And finally, just to draw out, the CCG also receives separate funding for the day-to-day running of the organisation, and this represents about 1% of our total spend. This completes the formal part of the AGM, and we wanted to take the opportunity to provide an update on our quality achievements during 2019-20 and our future direction of travel. I would like to take the opportunity to welcome Alex Murray, our Clinical Director, to share this information with you.
Thank you, Alison. I'd really like to start off today by talking a little bit about improving quality and safety across our system and the work the CCG has been doing here. So there's a whole range of things that we do to both monitor and continuously improve local services, although today I only have time to highlight just a few of those. The first one is protecting our population and our staff from flu. As we all know, flu can clearly be very dangerous for the vulnerable members of our communities. But even for those who are fit and well, it often means several weeks off work and difficulties with caring or household duties. The best thing we can all do to protect ourselves, our families and our communities is to get the flu vaccine. Last year and again this year, we're working as a system across Somerset to ensure that as many people as possible can access the flu vaccine. And we're aiming to significantly increase the number of both health and care staff and the population who receive that vaccine this year, which is particularly important given the ongoing COVID-19 pandemic. We've received a national grant to provide quality improvement training for practice nurses in our GP surgeries. Over 80 practice nurses and in total 167 practice staff engaged in that training. The feedback from the training has been hugely positive, with nurses scoring the training 4 to 5 out of 5. And a clear message from the feedback with not just our practice nurses but our practice staff actively want to be part of improving the system and making a difference for patients, and value the training to enable this. James has already mentioned the Safe Spaces initiative, where we have over 60 pharmacies in Somerset signed up to offer pharmacy consulting rooms as safe spaces for people to disclose domestic abuse. At the same time, more than 70 staff colleagues across our NHS providers have registered to become domestic abuse link workers. They will receive additional training so they can also support staff to respond effectively to people who are experiencing domestic abuse. Next slide, please. Thank you. So the other thing I'd like to touch on is how we support our health and care partners across the system. Again, I'll just mention a few of the things our quality and nursing teams have worked on throughout the year. We were awarded the prestigious Septemeber Car Partnership Award for an innovative Somerset project supporting people to remain safely in the community. The project, delivered in partnership with the Yeovil District Foundation Trust, enables staff caring for people in a community setting, such as a nursing home, to identify additional care needs quickly and effectively, and enabling those care needs to be met. This enables people to remain living well where they are and preventing avoidable hospital admissions. The project has been piloted in a number of nursing homes and is improving both people's safety and their experience of care. And we're planning to expand the training across the county to support people to stay in their own homes wherever that may be, ensuring the care and treatment that they desperately need. We're also working with GPs and have been working for some time across Somerset to maximise annual health checks for people with a learning disability, as well as running a project that helps care staff support both the individual and their carers to prepare for their health check to ensure the greatest benefit possible is achieved. This includes the use of reasonable adjustments as highlighted in good practice in the LEADER review, and that's the Learning Disability Mortality Review Programme. It's worth noting that that report also highlighted the Healthy Living event we ran last November for people with a learning disability, and this forms just part of the work we're doing across the county to address the inequalities currently faced by people with a learning disability. We're now going to go on to talk about Fit for My Future, and I'd like to invite Maria Hurd, the Programme Director of Fit for My Future, to join me, and she'll talk in a moment about mental health. So Fit for My Future describes our joint plans for the system for Somerset going forwards, both health and care. And we're working with our health and care colleagues to further develop the strategy that will deliver on the Somerset vision for the population. As James mentioned, namely that we want people to live healthy and independent lives, supported by thriving and connected communities with timely and easy access to high quality and efficient public services when they need them. Throughout last year, this has seen work developing around a model for integrated care in the community, joining up primary care with community services and acute trust outreach, and linking to voluntary sector organisations so that we can begin to provide or develop a roadmap for how services could be provided in the future. People will have experienced this model in action with services such as rapid response, which helps to support people at home rather than needing to be admitted to hospital, and the early supported discharge service for people who've suffered a stroke, enabling them to return home safely earlier than they otherwise would, and ensuring the appropriate support is available for them. We've been looking at how we can expand and develop similar services to enable people to remain at home or return home early whenever and wherever it's safe to do so. And in fact, have successfully embedded some of these as part of the system's response to the COVID pandemic in recent months. It's really important to talk about the thinking we've been doing about prevention and early intervention, how to support people to live well, looking at how we link with communities to ensure that people have the tools they need to do the things that benefit all of our health and well-being, whether that be supporting social inclusion, people's emotional health and well-being, getting enough exercise, achieving and maintaining a healthy weight, including others. And we'll begin to see work around this coming out over the next 12 months. So where has all this led us? Well, at the beginning of the year, our neighbourhoods and community public engagement took place, where we spoke to over 900 people at 64 events and meetings across the county around these potential models of care to understand what's most important to our population, both in the how and where services are delivered, and how we can support people to care for themselves and their loved ones, enabling easy access to services when they're needed. We received over 800 responses to our online and paper survey, as well as petitions, emails, letters, calls, and comments through social media channels from both individuals and professional bodies. The engagement period was affected by the national restrictions put in place in response to the COVID-19 pandemic, and unfortunately a number of engagement events had to be cancelled. but people could still and did still continue to provide feedback and ask questions both online, via email, letter and through telephone. The engagement period ended on the 12th of April 2020, and Fit for My Future was officially placed on pause to enable ourselves and the system to redeploy to meet the challenges of the COVID-19 pandemic. We're now looking at how we relaunch that work, learning from the insights gained both during the engagement, but also from the response to the pandemic over recent months, enabling us to address the ongoing challenges we're facing as a system and looking to the future to ensure that we can both provide the best support for our population, address the inequalities that we've seen emphasised across the nation in recent months, and provide the best possible outcomes for our residents. I'd like to hand over to Maria now to talk about community mental health.
Thank you. I think we're having some technical difficulties with the video. If I move on and perhaps we can get that working whilst I'm talking.
Hi, so I am Kate Williams. I am the Associate Director of Mental Health, Learning Disabilities and Autism Commissioning at Somerset CCG.
Hi, I'm David Seeley. I'm Assistant Commissioning Manager for Mental Health Services for Somerset CCG. In Somerset, we have a high prevalence of anxiety and depression. Our ageing population means we have a high prevalence of dementia, and a significant proportion of our population are concerned about their mental health and seek help from primary care and other support services.
We wanted to increase access, so people being able to access the services that they need in a timely way to ensure that they get access to the treatment that they require. And the other element is that as part of the overall Fit for My Future programme, we have been doing a lot of work on the mental health ward consultation and have delivered a substantial public engagement and public consultation process over the last 12 months that has engaged really successfully with a wide range of stakeholders, and a decision on those beds will be due at the end of this month. We have won a number of bids and national trailblazer programmes, one of which is our new community models of care, which is a really innovative approach to how we care for people who have mental health needs, looking at our provision of normal mental health services, but how we can also utilise the power of the voluntary sector to best support those individuals. We've also had investment in mental health support teams in schools, which is really critical to ensure that our children and young people receive rapid access. Have also, because of coronavirus, stood up a Mindline 24/7 line whereby people in Somerset can phone the Mindline number and they get ready access to the Mindline support. We've used a lot of digital support that's had a really positive impact with patients and with staff as well. We've also had to make some changes around delivery models, and also we've commissioned some additional step up and step down beds.
As well as an increased focus on digital first, so delivering digital therapy and counselling to people wherever they are in the county through their devices. And
introducing and delivering on our new integrated community models for adults with a severe and enduring mental illness. And also our continued focus on suicide prevention, and also that we continue to blur the boundaries between services and ensure that the pathways of care are as joined up as we can possibly make them.
Thank you to Kate and David for sharing the work we've done over the past 2.5 years, working with staff, people with lived experience of mental health conditions, carers and colleagues in the voluntary sector to co-create a new model of mental health care for Somerset, which offers a full range of support from prevention and maintaining wellbeing through to crisis support and inpatient care. We're proud of this work, which has led, as we've heard, to an additional investment of £13 million coming into Somerset for adult mental health services. This means we're able to provide new services that didn't previously exist in Somerset. For example, we have launched Open Mental Health to support people with a mental health condition. as well as additional staff in existing services. This means we'll be able to provide much earlier, better joined up support to people experiencing mental health conditions. Our county-wide inpatient service is one small but important part of that mental health service, and we need to ensure that these provide as safe a service as possible. This has been the basis of our review and consultation with the public on our proposal to relocate the St Andrews ward in Wells to co-locate with Rowan ward in Yeovil, whilst keeping the number of beds the same. During this time, we attended 63 events, and spoke to 732 people. We reached over 3,500 people through a Facebook Live session and received 538 survey responses and 1 petition. I'd like to take the opportunity to thank everyone that took the time to share their views during that consultation. And we've used those views to share to inform our thinking on where our mental health wards will be located. And this will be taken to our governing body for a decision on the 24th of September. And I'd welcome you to join us at our governing body, which will be held virtually in the same way as this meeting, to hear our decision making. And now I'd like to hand over to David Heath, our non-exec director.
Thank you, Maria. I have a particular responsibility on the board for patient and public engagement. Why is that important? Partly, of course, because we have a legal obligation to make sure that the public are fully involved in how we run services and when we want to change current services. But we want to do a lot more than that. We want to make sure that the patient and the public are at the heart of everything we do. And I'll be honest, I think there have been occasions in the past when we haven't been very good at listening to people who live or work in Somerset. And that's why this year I think we've made significant steps to improve how we listen to your voices to shape and develop our services. To help that, we've brought our communications and engagement teams together to develop new ways of working. We've been working with our voluntary, community and enterprise partners. We have regular listening events as part of our engagement and consultation plans. We launched a citizens panel, and of course we have 65 patient participation groups across our GP practices, patient engagement groups in our NHS trusts, volunteers, governors and people champions, and they all together give us the chance to listen to you and talk to you about the things that are important and hopefully improve the quality of the services we commission. That makes sure that we have the right services, they're available at the right place, at the right time for you, your family and your friends. There for you when you need them. So how can you get involved? Well, here are some of the ways that you may want to contribute to what we do. We could join Citizens Panel, you could become a people champion, you could sign up for our weekly engagement newsletter, join your GP practices PPG, you could share your patient story with us, join Health Watch Somerset, get involved with Fit for My Future, follow us on Twitter or Facebook, attend a governing body meeting or join our Somerset engagement and advisory group. If you'd like to get involved in any of those ways and you need the address, then you can find it on our website and we would love to hear from you. Now I'd like to hand back to our chair for the evening, Lou Evans, who is going to deal with your questions.
Thank you very much, David. So part of the annual report is actually taking questions from you the public, and we've had 5 pre-supplied questions, and I'm going to take the first 3 now. So if you just let me read them out and we will get one of the board members to respond. So the first question is from an anonymous person. Since becoming my wife's full-time carer, I have become aware of the problems facing carers when they themselves have a hospital appointment. It is often not safe to leave the cared for person for the time that it takes to drive to and from hospital plus procedure time. These days it is much more difficult to arrange temporary casual cover, especially as elderly neighbours often have their own problems. In our case, my wife is a frequent faller who tends to fall away to and from toilet. Although she has an emergency call device An ambulance can take up to 5 hours to appear for a non-injury fall. Hospitals now strongly discourage the bringing of anyone additional to an appointment. So our problem is probably certainly shared by many. Will the CCG please consider this problem carefully? And I believe that Alex, you're going to pick this question up.
Yes, indeed. Thank you, Lou. So absolutely, this is a common problem, and much more so since the pandemic, when, as you mentioned, loved ones or those being cared for can no longer attend appointments for the person that is caring for them. We also recognise that casual support is much more challenging, with the need to socially distance and protect the vulnerable from potential cross-infection. However, we are working to support people through the development of neighbourhood teams and the multidisciplinary meetings that we're creating. We're joining up the health and care response. This helps us to know about those individuals who may struggle with this situation and enable support workers such as village agents or health connectors to help find solutions. At the same time, we're also looking at ways to offer greater support remotely, so reducing the need to physically travel to hospitals to attend appointments, to reduce travel time and the time away from home for all of us, including carers and their families. Lou, I'll pass back to you.
Thank you very much. And if I can just remind everybody, these will be published on our website, the questions and responses in the next few days. The second question was from Ruth Hobbs, Somerset Parent Carer Forum, CIC. Over the next year, the CCG will have lots of competing priorities, including the increasing needs of our ageing population, addressing the recent SEND area inspection requirements, and further pressures from COVID. The CCG do not have infinite resources, so how will you manage and prioritise these areas? And I believe, James, you're going to pick this up. I think you're on mute, James.
Apologies.
Okay, no problem.
Apologies, so thank you. So Ruth, thank you for your question. And as you know, the CCG always has competing priorities for its resource. And what we do each year is we state our commission intents and we look into both the national and local priorities, and we're very well supported by a clinical executive committee that support me in that decision making as we look across the needs of Somerset. The three specific issues you've highlighted of an ageing population, the recent special education needs and disabilities inspection, and the pressures of COVID actually have all been addressed in our current priorities. And Chair, if I may, I know we're not going to have time for all the questions, but I also saw some comments from Julie about the SEND special education needs, and we will address those, Julie, by writing to you following this meeting. So thank you for those questions.
Great. Thank you very much for that, James. We've had another anonymous question, and this related to a very sort of complex issue around drug and alcohol misuse, the turning point, and how the CCG and the council are adapting all this. I am going to pass this on to the Somerset Council because I think they're better placed to answer this question, and we will come back and put that on our website when we have the appropriate return. So at this stage, I think we're going to enter stage 2, and I would like to hand over to, I think it could be a double act with Dr. Alex Murray and Trudy Grant, Director of Public Health, on Somerset's COVID-19 Outbreak Management Plan. So
thank you, Lou. That's a good introduction. Well, what can I say? What a year it's been. It's been a challenge, to say the least, for all of us. Let's face it. I don't think there's any director of public health in the country that wants a pandemic on their watch, but we've got one, so we're dealing with it as best we possibly can. So the outbreak management plan is something that we were asked to do from central government, published very quickly by the end of July. So the Somerset system really got together and cracked on and rose to this challenge. It describes really the way in which we're looking to prevent and manage COVID-19 outbreaks going forward, recognising that we are going to have to work out how we live with this virus for a bit, potentially at least until we get a vaccination for it. So the outbreak management plan really focuses on 4 main aspects. The first one is about preventing the spread of the outbreaks in the first place. This is the bit that we'd really like to do most of our focus on, because if we can prevent it in the first place, then actually that's a far better position for all of us, better position for our health services, and a better position for our economy. When we do get outbreaks, part of what we've got to do and part of the role that public health plays is making sure that we identify the outbreaks as early as possible. So we have a regular surveillance of all of the data on a daily basis, less than daily even. And then once we've identified those outbreaks, we then work together as a system and with the population and with businesses and schools and people like that to manage those outbreaks as best we possibly can and make sure that we reduce the further spread of those of that infection as much as we possibly can as well. As we go on, it's a novel virus that we're facing in this country, and so as we go on, it's really important that we learn from those outbreaks, both the ones that we're seeing in Somerset, but also the ones that are seen in other parts of the UK. So we are learning from them as we go, and we're making sure that we feed that learning into the outbreak management response. Wrapped around all of this, it's really key that we keep people engaged in the whole thing and keep the communication going. As you can imagine, the only way really that we're going to get on top of this virus is by making sure that we all work together and we've all got a part to play. Okay, so moving on to the next slide, I wanted to show you the pandemic curve, as we call it. So this is our local position in Somerset, right from word go at the beginning of March when we got our first cases, right the way through to the current day. So you can see there's quite a big block of yellow there, which shows the first wave of the local epidemic. We then obviously went into lockdown. It took some time for that epidemic curve to come down, but it did come down. We've been bubbling along at very low levels in Somerset for quite some time. We're still at very low levels in Somerset. We are well below the national average, and actually we're below the southwest as well at the moment. And long may it last. I'm sure that's good news for everybody. We are, as you can see from the graph, starting to see a little tail upwards now. So our infection rates are starting to increase as society has opened up, which, as you've known from things like watching the chief medical officer on the TV and things like that, that was kind of expected that we probably would see some upward trend, and it's about controlling that upward trend, making sure that we don't lose contact with it. And trying to make sure that we protect those vulnerable people and protect our NHS services. So we're working really hard when these outbreaks occur. We're working really hard to make sure we get on top of them as quickly as we possibly can, and then we move on to the next one, So we're looking at the situation on an almost hourly basis, to be honest. And moving on, the last thing I wanted to say really is a huge thank you. So Somerset has seen lower levels than nationally right the way throughout this pandemic, and it's largely as a result of the Somerset people doing the things that they need to do. So sticking to the rules largely and that's been really beneficial. We've also, as a system, we've worked really well together, really hard, and I think we've taken our outbreak response to a whole new level working across our system. I think the only way, as I said earlier, the only way we're going to get on top of this now is to make sure that everybody in Somerset keeps sticking to the rules. We've got to keep the infection control measures in place and stick to it really rigidly. I just want to emphasise hugely everybody's responsibility. So making sure that you wash your hands, making sure that you don't touch your face, as much as you possibly can. It's really hard to do, but don't touch your face if you can help it, and wear a face covering where it's needed, and make sure that you keep that space around you. So keep at least 2 meters if you can possibly do so. So hand, face, space. We've got to keep on remembering that. Okay, I think I'm going to pass over to James now to give you a bit more of a flavour as to the COVID response within the NHS locally.
Thank you, Trudy. And if I perhaps start by thanking you for your leadership around this. This is something none of us ever faced, none of us ever wanted to face, but your leadership around this has been really something to be beholden. So thank you very much. It's a big role, the Director of Public Health, and you've filled those boots really well. So we're all appreciative of the role you've played. So thank you. It's also an opportunity to thank the people of Somerset who've responded to our request to tell us how it's been through COVID. So we've sent out a request, and over 1,000 of you have shared your views, and we're really grateful. And perhaps I'll just pull out a few key themes. Digital versus face-to-face is clearly ongoing. We've had a digital transformation. Many, in fact, most of you like that, but not all. So we will make sure we have that blended approach going forward. You've also highlighted the what about our routine services. I think I touched on that at the start, but we will endeavour to make sure that we're really clear about what services are available. The NHS remains open. Please do use us for both emergency care and planned care. We will write you for planned care, and the talk before you walk, think 111. Is really important, so that you're expected when you come into our services. We're using those facilities, the telephone and digital where possible, and a lovely plug and the response of the voluntary and community sector has played in supporting us through this process so far and ongoing. So huge thank you. So I did want to take the opportunity to pull that out. I'm now going to finish my piece with 3 little pieces from our partners. I talk about the importance of partnership working. So firstly, Andy Heron is the Deputy Chief Exec at Somerset Foundation Trust.
It's been an extraordinary year in Somerset, as it has been for the whole country. As COVID-19 began to bite in the early part of the year, and it became clear that it was a major situation across health and social care. It was a privilege to be able to work with colleagues right across the system in Somerset, and as we came together as providers, and the CCG, social care and primary care, with of course the voluntary sector, we were able to move through a phase of planning at a pace that I have never seen before, and colleagues at the CCG were absolutely pivotal in this. I think we were all delighted to set aside our normal roles of provider, commissioner, and to become Team Somerset. And I think as a result of that, certainly in my sphere, in community and mental health services, we've managed to come up with a range of services and a response that we could have only dreamed of, really, in terms of moving at pace, changing the way that we work. I think we're mindful now that this new way of working, of co-producing services together, is something that we don't want to lose in the future, and we're looking forward to take that through into the ICS. It's a very different world now. We're working together in a really different way, and I'd just like to thank my colleagues at the CCG, many of them, for all that they've done to support us in the past few months, but also in developing our plans for the future. It's been great working with them. Thank you very much.
So many thanks to Andy for those words, and for all our colleagues at Somerset Foundation Trust. It's clearly a day for the deputies, because our next video is from Shelagh Meldrum, who is Chief Nurse and Deputy Chief Exec and Director of People at Yeovil Hospital. So Sheilagh's words.
Hi, I'm Shelagh Meldrum. I'm the Chief Nurse, Deputy Chief Exec and Director of People here at Yeovil Hospital. Obviously, the last few months have been trying, to say the least. Everybody's worked really, really hard in the most uncertain of times. I wanted to reflect really on the help and support and guidance that we've had from Somerset CCG and the colleagues that work there. That help has ranged from some members of staff coming and joining our intensive care team because they have the skills to be able to do that, and it was the best use of those skills at that time, and we're hugely grateful for that additional support that those members of staff gave us. To the daily calls where we've managed to sort of seek guidance, ask the CCG for help around things like PPE, etc., which was invaluable at the time. And just to the occasional call from the CCG where people asked how we were doing, were we all right, and nothing more. That sort of thing is really, really important to show that we're working as one system and that we're all in this together. So a big thank you from us at OneEngage.
Thank you, Shelagh. And Shelagh mentioned colleagues moving across to work for them. One of our colleagues, Hugh Archibald. So I'd like to finish these presentations with Hugh Archibald, one of our quality and nursing team, safety team, going across to YDH. Over to you, Hugh.
My name is Hugh Archibald. I'm the quality lead for urgent care and risk management at Somerset CCG. I'm also a registered nurse. After hearing about the outbreak in China and Italy and hearing from my colleagues about the outbreaks up in London, I knew that to keep people safe, I had to be able to offer my intensive care skills. I took on a role in Yeovil District Hospital as a staff nurse, working one-to-one in intensive care with patients that were on ventilators or who had coronavirus, and this was really to support the influx of patients that there may have been and also support the staff that were there. Going back to the front line and working with intensive care really reaffirmed the reason why I went into healthcare in the first place, and that's to help people, and that's why I'm in a role like I am today. I'd like to thank all of the businesses that supported local hospitals and nurses on the front line, and I'd also like to thank Yeovil District Hospital for looking after me whilst I was there. I'm really grateful to have this opportunity, and I'd like to thank my line manager and also my team for being able to support me to be able to go back to the front line. Thank you.
Thank you, Hugh. And I started this meeting by talking about the pride I have in colleagues, health and care colleagues across Somerset, the bravery, the resilience they've shown, and Hugh exemplifies it, as do many others. But thank you, Hugh, for those words. So, Lou, perhaps I could pass over to you now for any closing questions and comments as this meeting comes to a close.
Thank you very much. Now, I have two that were sent in to us, and they're both related to COVID, so I will take these two now. This one question is from Mr. Sigurd Reimers, Chair of Lingford Park Surgery PPG. During the COVID pandemic, many primary care consultations are having to take place by telephone or video in the interest of safety. This is a format that can work efficiently and humanely and is helping primary care staff manage an extremely challenging task. However, recently the Health Secretary has urged that GP consultations should be remote by default, even beyond the COVID crisis. Again, this can be an efficient and humane method in many cases, but what steps will CCG take to support practice staff and to monitor how safe such an approach is turning out to be, given that primary care consultations often there's a bit of feedback there, often taking into account factors including emotional ones that are not always evident at a distance, and that may affect the accuracy of any assessment of a patient problem. Now, I think, Alex, you are primed to answer that question.
Yes, absolutely. Thank you, Lou. So absolutely, at the start of the pandemic, primary care did move to what we call a total triage process for all appointments and inquiries, as we were guided by NHS England. As many will know, that does mean that everyone receives either a telephone, online or video consultation before any face-to-face appointment can be made. And this is to help reduce footfall within practices and so reduce the risks of transmission of COVID-19. We know from the engagement that James mentioned earlier that 80% of our population value this, but about 20% struggle for a variety of reasons, whether that's due to disability, mental health issues, or just personal challenges. It's very important, though, for us to recognise that face-to-face appointments are still appropriate and available, either for clinical reasons or taking personal factors into account. As a CCG, we support GPs and practice staff to ensure that when required, face-to-face consultations are able to be conducted safely with the appropriate PPE, social distancing and other preventative measures. Through the NMC, we have daily contact with all practices and follow up directly when they're struggling or flagging concerns to ensure that these can be addressed collectively by us as a system, and any support offered to ensure that the most appropriate form of consultation for any individual can be supported both now and in the future. At the same time, we're continuing with our engagement across the county with our patients and our population to ensure that we're meeting their needs again, both now and into the future. Thank you, Lou.
And then I've just got one, I think maybe the final one actually, but Nick Chapman, North Curry Health Centre. What steps are being taken to reduce the volume of documentation and bureaucracy in our communications to primary care? This has been perfectly highlighted during the COVID pandemic, with most practices struggling to read every email from various sources. Alex, I think you're going to handle this as well.
Yes, thank you, Lou. That's one of the things of being a GP.
Yes.
So the amount of information and emails through the pandemic was significant, not just for primary care, but really across the system. As a CCG, we collated and reviewed that information on a daily basis and included it within a primary care pandemic bulletin that was sent to each practice to ensure practices had all the information they required in one place. I think it's important to say that there were additional communications from NHS England that have to go directly to practices, but we do continue to monitor those and to ensure that wherever possible, communications are kept to a minimum with ease of access and a clear process for practices to follow. And as a result of that, what we've seen is what was our daily primary care pandemic bulletin has now moved to a couple of times a week, but clearly we'll need to flex that over the coming months depending on what happens within Somerset. Thanks, Lou.
That's great. Thank you very much. Now, we have had a number of questions from the floor, but I think I said at the outset that if we ran out of time, we would actually come back to each one of you individually, and we'll also make sure that they're posted on the website. And unfortunately, that is the case. But I would like to, before I hand back to James, just make a comment on behalf of Jane Chidikar, one of our non-execs, who I think actually speaks for us all. And she would like to say this to you, James. I would like, as a non-exec director of the CCG and as a Somerset resident, to add my thanks to you and all our health and care and public sector workers for their invaluable contributions during this COVID pandemic. And I think that is a really sounding statement on how we all feel, James. And on that note, I'm going to hand it back to you to close this annual general meeting.
Thanks, Lou. Thanks, Jane. And thanks, colleagues. So it's much appreciated. Can I start off by thanking all those who've joined us this evening? I'm so sorry we can't see you. I'm so sorry we can't be with you. Hopefully you found this new way of working helpful and a way of holding us, finding out what we're doing and holding us accountable. We're here to serve you and your needs. So really helpful. To all our partners who've joined us, thank you so much as well, and thanks for all you do. Please do contact us, give us feedback. I even believe we have a postal address should you wish to use that method as part of it. So we'd love to hear from you. Can I thank our health and care colleagues across Somerset? Jane, you said it so well, but over the last 18 months, the 12 months of the annual report and the last 6 months of COVID, CCG colleagues, my governing body members, but also can I thank those who behind the scenes have made this work. I think technically it's been a really successful evening, so hopefully it's been able to come across that way. Thank you. Safe journeys home. I'm sure that means it's moving from one room to another, but look after yourselves, stay safe, and please remember, as Trudy said, hands, face, space, as we keep moving forward in this pandemic. Please keep communicating with us and we will answer all your questions. Thank you.
Thank you very much. And on that note, James, we will close this virtual meeting. Thank you very much.
Thank you.